What was your reaction when you heard that you had been selected?
Dr. Tatum is joining 34 physicians all around the country.
The heart was probably at about 130 to 150 beats a minute because I was so excited.
Knowing the people who've won the award before me, to be included among them.
It's been validation that all the work is important.
The magnitude of it, I'm just full of thanks.
As a group, those 34 physicians are the leadership of palliative care in this country, if not in the world. The Cunniff-Dixon Foundation was started in 2006. My wife, Carly, was diagnosed in 2001 with metastatic breast. And at the end, we were at home. We had an experience that even today, too few people are privileged to have at the end of their lives. It was all under the guidance of Peter Dixon.
It's about good doctoring. And by that I mean somebody who focuses not exclusively on the disease, but on the patient. It's about listening, it's about listening, it's about listening.
A lot of what I do now is mentoring and teaching. I love to do it, but we also have to do it because there aren't enough specialists around. On any day, we've got 50 people that we're seeing in the hospital.
Who is seeing all these patients?
We have cases where we're dealing with goals of care discussions, where our nurses and social worker can do as good of a job, if not better, in terms of the way that they connect with families.
In getting to the heart of what matters in relationship, who is this person, who is their family, what matters most.
Tell me about your life. I got 85 years I have to learn. What's important for me to know about you?
My focus is on to help people live the best they can as long as they can in a situation where we might not be able to cure the underlying problem. So how do we help to focus on symptom management and quality of life?
Which gets at this whole notion of comprehensive whole person caring as the essence of good doctoring.
We can help on symptoms, we can help on difficult emotions, but we can also help on planning.
That's probably the most important thing.
I think palliative medicine, we must be the educators that help all doctors regain that core skill.
I grew up with a mother who had rheumatic heart disease and was in bed every day that I came home from school. And so I was used to chronic illness. I was a religion major in college, and I have been drawn to the spiritual aspect of medicine from the get-go.
Because there's a difference between being cured and being healed. Death is not the defeat. How do we help them to be more comfortable in that process?
I think when you bring in people from cultures where there are very different norms and beliefs, we have to be extra sensitive in those situations. Right now it just feels that we've shifted away from the fact that these are people and what do they want and what's important to them.
And even though there are the constraints of time, there are the constraints of finances, we all really need to take some responsibility for basic discussions about end-of-life preferences, about advanced directives or advanced care planning.
Advanced care planning, I think it's ultimately that the physicians need to guide. And so we've developed a program recently where we go to their home. We're helping those families and the patients talk those conversations that the patient's not been able to have in the office.
Good doctoring is also, I think, about being selfless. It's about the person in front of you, it's not about you. Understanding their health, understanding what they're doing, understanding what their goals are.